Hey guys, welcome back to the channel. It's me. Today is Surgery Squad Sunday. So I was thinking that we could do something, but something not too disgusting, because look at how nasty this looks. Like, look at that. That's disgusting. So either we're going to do braces, natural childbirth, or childbirth with epidural. I think I'm going to play two, but I think we're going to go ahead and do braces first. Alright, let's... Oh. That is disgusting. Sorry if it's like not full screen, it'll be a little...
Welcome to Surgery Squad. I'm Dr. Jeff, and today we're going to talk about braces.
Oh.
Those fantastic bands and wires that help straighten out crooked teeth.
Okay.
Let's face it, most of us do
snap.
not have perfect teeth.
Okay.
Everyone's smile is unique. Some people's teeth are just a little more out of shape than others.
Yeah, okay.
Your teeth might be crooked, or your upper and lower jaws might not be the same size. If your upper jaw is bigger than your lower jaw, that is called an overbite.
No kidding.
If your lower jaw is bigger than your upper jaw, you have an underbite.
Yep.
Sometimes your mouth is not large enough for all your teeth. That is referred to as overcrowding. In all of these cases, the problem can be fixed with braces. Braces are a series of brackets, wires, and bands that are used to guide your teeth back into the correct position. This improves looks, makes it easier to chew, and at times even improves speech.
Yeah.
Our patient today has what looks to be an overbite. We want to see how noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
Okay. No. Oh, okay.
Next, we'll take an impression of the teeth.
Oh.
We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like
What?
candy cane and chocolate cake.
Oh,
Can
snap.
you put the mold in the mouth?
Okay. There you go. Oh! I think it was like up here.
Great job. We'll have my assistant make the bottom impression. Once we have them both,
Oh.
we'll use the impressions to make a plaster model of the patient's teeth. Okay, we've got our impressions and x-rays,
You got
and we
fucked
can
up
see
teeth.
that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place.
Oh.
Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth. Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Oh. What do I click and drag? Snap, this looks scary. Sorry, woman, I didn't mean to do that.
Wow, what a marvelous job. I can almost
Thank
see
you.
myself in those teeth. We need to put on some molar bands to anchor the braces.
I hate those.
They circle the whole tooth and have a hook on the outside of the tooth.
I hate those.
Slip the molar band over the tooth. We'll cement it into place later.
Ouch.
Great. Now we can start putting the bonded brackets on the rest of the teeth. We've placed a lip guard over the teeth to give us room to work.
That looks like
Let's
condom.
rinse off the teeth. Can you spray them with water? I'll run the suction to remove the water.
I literally just went.
Let's spray some air to get the teeth nice and dry. Can you handle that for me?
Nope. Again.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Oh, snap.
We let the bonder dry for a minute or two so that it is sticky.
Sorry.
Then we place a bonded bracket onto it.
Oh, okay. Wow, this is easy. You got messed up teeth, man. What do I do? What do I do?
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
Okay, so it says...
Great job! Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires.
What the
The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
Okay.
Good job! We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
Ew. Those are some messed up looking bands.
And with the last ligature in place, our patient is done for today. In the next few days, she might experience some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist. It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth. Our patient will have regular appointments about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces, and then additional time with a retainer. The true length will vary by patient. She might also need additional equipment such as elastic bands, coil springs, or headgear. We will not know until we see how she responds to the braces. There you have it. The braces are in place, and our patient is on the way to a beautiful straight smile. Thanks for coming by Surgery Squad. Why not check out one of our other procedures here on SurgerySquad.com?
We're not doing that. I ain't doing breast cancer. Okay, so we'll do one more. Do you want to do childbirth? Boys, please don't watch this, you know. Ew! What the fuck? That was a messed up looking baby. I'm sorry.
Welcome to Parent Point. I'm Dr. Rachel, OBGYN, and I'll be walking you through an interactive natural childbirth today. As a doctor, the birth of a baby is the most remarkable thing that I get to experience. While much of the process during childbirth is the same from woman to woman, each birth is still unique in its own way. Did you know that more than 2/3 of all babies born in the United States are delivered vaginally? And average costs for a vaginal delivery without complications in the U.S. range from $6,000 to $10,000. Whether a woman chooses to deliver vaginally or through cesarean section, commonly referred to as a C-section, I always recommend that my patients do their research and make an informed decision based on their personal medical history and circumstances. Natural childbirth is the process of giving birth to a child without medical intervention. No drugs are given to relieve pain or aid in the birthing process. Most doctors find this approach to be the safest for the baby. While pregnancy is commonly thought to last 9 months, in fact, it's a little longer. A normal gestation period for a single birth is between 37 and 41 weeks. Nearly 80% of all newborns are delivered at full term, with 11% coming early and 10% post-term. Most women go into spontaneous labor, but about 1 in 5 women are induced. This means that they are medically forced to start labor, usually for the safety of the mother or the baby. A standard delivery is separated into 3 stages of labor, typically lasting from 5 to 24 hours, depending on the conditions. The first stage is the beginning of labor, which is characterized by the onset of contractions and the dilation and effacement of the cervix. The next stage is the actual delivery of the baby. The final stage is the delivery of the placenta,
Ew.
which is an organ that connects the developing fetus to the uterine
That thing's
wall
huge.
to allow nutrient uptake, waste elimination, and gas exchange via the mother's blood supply. Now that we've covered the basics, let's deliver a baby. Our patient today is in her late 20s
What the
and is
fuck?
in pretty good health. She came into the hospital after her contraction.
Hold up. She's the one that just got braces. And she's pregnant? Okay, that's messed up.
A fetal monitor will be used to make sure mother and baby are doing well during labor and delivery. 2 electrodes are placed on the mother's abdomen to monitor the baby's heartbeat. In addition, a blood pressure cuff will be applied to check. Our patient and baby are doing fantastic. Let's feel the patient's stomach to check on the baby's position. Great! We can feel that the baby is positioned to come out head first, so we do not have to worry about a breech birth, that is, where the baby is positioned feet first. Whoa! Our patient's water just broke. Now the amniotic sac is broken. We need to get our patient to assume the birthing
Did she
position.
just like pee?
We can see that her cervix is effaced and fully
Okay.
dilated at 10 centimeters, so we are transitioning into the second stage. Our patient is now having some painful contractions, so she is doing the breathing exercises she learned in her prenatal classes. Remember, since she has chosen to have a totally natural birth, we won't be administering any pain medication. Okay, now we want her to bear down and
Oh.
push.
Okay.
There it is. I can see the baby's head crowning. Occasionally, forceps or a vacuum is needed to help ease the baby through the birth canal, but we are doing okay right now. We are, however, going to help our patient slightly using our hand. This will provide added space for the baby to come out. The baby's head rotates as it exits the mother's body. Before we fully remove the baby from the birth canal, we need to make sure the
Still
umbilical
pushing.
cord isn't wrapped around the baby's neck. Fortunately, in this case, it isn't. Let's help the baby turn to slip its shoulder out. The rest of the body will follow. The baby is born. Now, let's remove excess fluid from the baby's airways using the suction guard. We're almost there. Clamp and cut the baby's umbilical cord in order to detach it from the placenta.
Oh, you have it. Okay.
It's a baby boy. Our team of nurses will clean off the baby, but we're not done yet. An APGAR test.
I'm sorry, I don't want to listen to that.
The APGAR is a test performed at 1 and 5 minutes after birth to determine how well the baby is doing. The doctor, midwife, or nurse will assess the baby's breathing, heart rate, color, reflex response, and muscle tone and assign a score ranging from 0 to 2. While some staff members are tending to the baby, others are with the mother because her work isn't done. During the final stage of birth, the placenta is delivered. Removing the placenta requires just a bit more pushing by our new mother. If there are any tears to the cervix or vagina during birth, we would suture them, but in this case, our mother is fine. Sometimes, a doctor will perform an episiotomy, which is a common practice in which the mother's vaginal wall is surgically cut during the second stage of labor to provide a large baby to pass through the birth canal more easily to avoid excess tearing. After birth, the cuts are sutured. Great job! Now the recovery process for our mother begins. Most mothers are able to walk and care for the baby within a few hours after birth, and it is ideal for both the mother and baby to spend time together and bond. One way the mother and baby will bond is through feedings. If the mother has chosen to breastfeed, The nursing staff will assist the mother to make sure her baby latches on and feeds as soon as possible. Breastfeeding is the preferred option, but several factors may make bottle feeding the feeding method of choice. A pediatrician will examine the new baby in the hospital.
You guys get it. Thanks for watching.